Here is Headache Gems Part 2 with Dr. Cookrin.
All right, let's dive into the fascinating connection between the trigeminal system and the muscles in the cervical spine. Research shows that when the head shifts too far forward on the upper back, commonly referred to as head-forward posture, it can lead to various types of headaches. This creates a neat little web of interactions that highlights the effectiveness of chiropractic adjustments in the neck. We're going to focus on an adjustment to the first rib, which can help correct posture. By doing this, we can relieve trigger points in the surrounding muscles. This relief may, in turn, reduce the pathological input to the trigeminal system, which is linked to the onset of many headache types. So, let's explore how all these pieces fit together and how we can effectively implement this approach. First, I'll dive into a few studies that highlight a growing trend, the way we hold our heads and necks, especially that pesky forward head posture can really impact the muscles in our necks and is linked to different types of headaches. So let's explore what the research has to say. As I mentioned, there's an increasing amount of evidence backing this idea. This meta-analysis provided strong evidence that chronic headache patients show greater forward head posture compared to both healthy individuals and those with episodic headaches. The large sample size of over 1,000 participants adds considerable weight to these findings. This recent study explored an innovative combination of treatments for patients with chronic neck pain and tension headaches. The addition of eyeball exercises to traditional treatments showed promising results, suggesting the importance of addressing multiple aspects of head and neck function. This controlled study provided clear evidence of postural differences in chronic tension-type headache patients. The findings demonstrated not only increased forward head posture, but also reduced neck mobility, with a direct correlation between posture and headache frequency. Recent research has challenged some previous assumptions about the relationship between trigger points and posture in headache patients. While gender differences were identified, with women showing greater sensitivity, the direct correlation between trigger points and posture was not as strong as previously thought. In conclusion, these studies collectively demonstrate the complex relationship between head posture, muscle function, and various headache types. While clear patterns emerge in some areas, and the variation between individual patients and headache types suggests the need for personalized treatment approaches that address multiple aspects of the condition. All right, let's dive into my version of the first rib adjustment. So here's the setup. I've got my left hand resting on the patient's shoulder with my thumb positioned just below the clavicle. You can spot the thumbnail marked with a blue star, and the red bar above it shows the location of the clavicle. Remember, we're not adjusting the clavicle itself. Instead, we want to focus on the area just below it. There's a soft spot in the tissues where your thumb will sit perfectly. Next, slide your opposite hand down. Mine is my right hand, and place your pisiform right over that thumbnail. This sets you up nicely for delivering the adjustment. Oh, and here's a pro tip. This technique works wonders if you have a thoracic drop piece. Our tables come equipped with upper thoracic drops, which really enhance the gentle manipulation we're aiming for. Now let's see how this all comes together. All right, let's dive into this adjustment process. Remember, this is always a bilateral adjustment. In the previous slide, we covered the setup for the patient's right first rib, and now we're shifting our focus to the left rib. Take a look. Your right hand should rest over the shoulder with your thumb positioned just below the clavicle at its sternal end. You gently palpate around under the clavicle you'll discover a little indentation or soft spot in the muscle. This is where your thumb fits in perfectly. Next, we have the cover hand, with the pisiform resting over the thumbnail of your right hand. The adjustment itself is a subtle motion, moving slightly from inferior to superior and anterior to posterior. You'll notice the arrow indicating the line of drive. Now, I'll be using a drop table piece for this adjustment. The key here is that you don't need to deliver hard thrusts. I usually go for 3 gentle thrusts on each side. It's a general adjustment, so let the table do the heavy lifting. And a crucial tip: avoid adjusting the clavicle itself. We definitely don't want to risk dislocating or subluxating it. The focus should be on the rib just beneath the clavicle. After the adjustment, we'll check to see if there are any changes in the patient's structure. Our goal is to reduce that forward head posture, which could help alleviate one of the triggers for headaches. Let's see how it goes. Here's how to guide your patient through the process. Have them stand comfortably in an upright position, whether that's sitting in a chair or standing tall. Ask them to close their eyes and gently nod their head back and forth a few times. The goal is for them to stop when they feel that they're looking straight ahead. That's your cue. Take the picture or X-ray. Take a look at the photo in the upper left corner of the slide. It clearly shows the dramatic forward head and thoracic posture of this patient before the adjustment. Now shift your gaze to the right side of the slide, where you'll see a remarkable reduction in both the structure of the spine and the forward head posture. As we discussed, this misalignment can be a contributing factor or risk factor for various types of head pain. Now let's dive into the radiographs at the bottom right corner of the slide. You'll notice a 43 millimeter anterior head displacement on the before X-ray, compared to approximately 22 millimeters on the after X-ray. This not only highlights the postural changes, but also showcases significant structural improvements. These adjustments can be achieved quickly, and I highly recommend incorporating this technique for any patients with forward head posture or even those suffering from headaches. It's an incredibly effective approach.
This slide, taken from Neuromodulation 2015, Reed et al., shows the position of the implantable electrodes. You see here highlighted in blue, and you can see the little dots that are the actual electrodes implanted under the skin. Above the eye, they stimulate the supraorbital nerve, and at the base of the skull, they stimulate the occipital nerve for the purposes of modulating the central portions of the trigeminal complex. Another technique for modulation of the trigeminal nerve using surgically implanted electrodes is modulation via the supraorbital nerve, seen here on the left, and the occipital nerve, seen here on the right of the images here. Either one or both of these techniques can be combined and are growing in popularity for the treatment of intractable migraine and other forms of headaches. Let's take a look at laser acupuncture of the supraorbital nerve. You can see the acupuncture point to the left of the slide and the actual location on the patient to the right of the slide. Research published in BMC Neurology 2017 of May suggests that 3 months of preventative treatment for migraine with supraorbital nerve stimulation was an effective, safe, and well-tolerated treatment option for migraine patients who did not respond to medications. This is exciting. We can use electronic or laser acupuncture on the surface of the body to, within 3 months' time, provide an effective relief of migraine for our migraine patients. Here's another laser acupuncture point that we use. You can see on the left of the slide here, it's the inferior orbital nerve. On the patient's picture, you can see right below the eye, and these are bilateral points. In a study entitled Acupuncture for Episodic Cluster Headache, a Trigeminal Approach, the authors found that they could treat cluster headache with an acupuncture stimulation applied to points related to the infraorbital branches of the trigeminal nerve. So we're developing a point prescription of acupuncture for headaches involving the terminal branches of the trigeminal nerves, all for the purposes of modulating that activity of the headache circuit deep inside the trigeminal ganglion. This is from the journal Neural Regeneration and Research, 2017 of May. And here we see the gallbladder 20 acupuncture point, which is associated with the occipital nerve, which is another branch of the trigeminal system. And the authors report stimulation of gallbladder 20 relieves migraine pain by modulating the trigeminal ascending system, the headache circuit we've been talking about, in part by inhibiting calcitonin gene-related peptide expression in the trigeminal ganglion. So at the beginning of this slideshow, we talked about how calcitonin gene-related peptide is a hot topic in research into the treatment of migraine and in drug development. Now we see that we can use non-invasive acupuncture on the trigeminal peripheral nerves to modulate the levels of calcitonin gene-related peptide deep in the brainstem in the trigeminal ganglion. This is really good news for our patients suffering from migraine.